8 medications that harm memory and brain health. Could the medications we rely on be silently harming our memory and brain function? It's a question worth asking, especially when the answer could change lives. What if identifying these culprits could help protect your cognitive health and enhance your well-being? Science has revealed a hopeful truth. Memory loss is not an unavoidable part of aging. Yet, certain medications, when misused or taken without proper guidance, pose serious risks to our brain health. How do common prescriptions become threats? And how can we safeguard our minds while managing other conditions? Emerging research highlights alarming connections. Proton pump inhibitors, such as omeprazole and anticholinergics prescribed for Parkinson's disease, have been linked to a heightened risk of dementia. But how many of us truly understand these dangers? Self-medication often compounds the problem, making awareness even more critical. Stay with us, because the 7th medication on our list is shockingly dangerous, and almost no one is talking about it. We've included all the references we used in this video in the description below. Dive in with us as we uncover the hidden risks and empower ourselves to make informed choices. Let's get started. Aging and dementia, unveiling the truth. For decades, dementia was seen as an unavoidable aspect of aging. Society accepted cognitive decline as an expected outcome of growing older. Yet, modern research tells a different story. Memory loss and mental deterioration are not inherent in the aging process. Dementia, including Alzheimer's disease, stems from distinct biological mechanisms, not from the simple fact of advancing years. This revelation transforms how we think about aging. Studies reveal that cognitive sharpness can endure, even flourish, with the right approach. Managing risk factors and embracing positive habits can have a profound impact. Nutrition plays a pivotal role, with balanced diets rich in essential nutrients supporting brain health. Physical activity enhances blood flow to the brain, nurturing its vitality. Mental challenges and social interactions further strengthen cognitive resilience. But not all influences on the brain are positive. Silent threats often go unnoticed. Prolonged stress, head injuries, and poor sleep habits undermine mental performance. Alcohol abuse, smoking, and strokes exacerbate the risk of decline. Nutritional deficits, particularly in vitamin B12, deprive the brain of critical resources. Untreated psychological conditions, like depression and anxiety, also contribute to cognitive vulnerabilities. Recognizing these factors is key to prevention. Scientific advances shed light on the molecular underpinnings of dementia. Abnormal protein deposits, such as tau tangles and beta-amyloid plaques, disrupt communication between neurons, ultimately leading to their destruction. While some individuals carry genetic predispositions, these are not definitive. Environmental factors and lifestyle choices wield significant power in shaping outcomes. The fight against dementia is multidimensional. Preventative strategies blend healthy living, chronic disease management, and timely medical care. Innovative therapies are being explored, from drugs targeting protein buildup to interventions designed to stimulate neural repair. Each breakthrough brings new hope to millions worldwide. The hidden triggers of memory loss. Memory loss is a complex puzzle shaped by many surprising factors. While aging and neurodegenerative conditions often take center stage, other, less obvious influences can quietly erode our cognitive abilities. Substance use plays a pivotal role. Alcohol can directly harm brain cells, while tobacco disrupts vascular health, restricting the brain's critical blood supply. Beyond substances, traumatic brain injuries, whether from accidents or contact sports, pose serious risks. These injuries can cause immediate damage or set the stage for long-term complications like chronic traumatic encephalopathy, gradually impairing memory. Strokes are another major contributor. They interrupt blood flow to the brain, damaging areas essential for memory and cognitive processes. Similarly, sleep is a cornerstone of mental health, yet insomnia and sleep disorders disrupt the consolidation of memories, making it harder to retain and recall information. Chronic stress is an often overlooked culprit. Elevated cortisol levels damage the hippocampus, a key brain region for memory storage. Nutritional deficiencies also take a toll. especially a lack of vitamin B12, which is vital for nerve health. Without it, memory lapses and confusion can become all too common. Psychiatric conditions add another layer of complexity. Depression dampens concentration and recall, while chronic anxiety overwhelms the brain's processing and storage capabilities. These emotional strains can create a cascade of cognitive challenges if left unchecked. Each of these factors paints a broader picture of memory loss, showing how deeply interconnected our physical, mental, and emotional health truly are. Medications that may harm your memory, the hidden risks. Every day, millions of people rely on medications to manage health conditions, often unaware of the potential side effects on their memory and cognitive function. While these drugs provide relief and address medical issues, their impact on brain health can be significant. Understanding these risks is crucial to safeguarding your mental clarity and overall well-being. Let's examine one of the most commonly used medications linked to cognitive challenges. Number 1. The hidden cognitive risks of omeprazole. Omeprazole is a widely used drug for conditions like acid reflux and heartburn. It belongs to the proton pump inhibitor, PPI, family, a group that also includes lansoprazole, pantoprazole, and esomeprazole. These medications work by reducing stomach acid, offering much-needed relief for digestive discomfort. However, their long-term effects on the brain are a growing concern. Studies have uncovered troubling patterns. In one study involving nearly 6,000 participants, prolonged use of omeprazole led to memory loss in 10% of individuals who took the drug for more than 3 years. Another report revealed that over 30% of users who relied on PPIs for over 4 years experienced cognitive issues. Why does this happen? The connection lies in how these drugs alter the body's balance. PPIs can interfere with the absorption of vitamin B12, a vital nutrient for brain health. A deficiency in B12 can lead to neurological issues, memory decline, and even irreversible cognitive damage. Additionally, these drugs disturb gut microbiota, a delicate ecosystem that directly influences mental and emotional well-being. Why omeprazole's accessibility is a concern. Omeprazole and similar PPIs are easily obtainable without prescriptions in many places, leading to widespread and often unchecked use. While their short-term benefits are clear, using them for extended periods without medical supervision can result in serious consequences. Misdiagnosis or self-medication further increases the risks. Medical experts recommend restricting PPI treatments to defined durations, typically ranging from 2 weeks to 3 months. Prolonged use is only advised for specific conditions and under close monitoring by a healthcare provider. Beyond memory loss, extended PPI use has been linked to several other health concerns, including kidney issues and potential failure, increased risk of bone fractures, higher susceptibility to respiratory infections, imbalances in gut bacteria that can lead to gastrointestinal problems, how to safeguard your brain health. Protecting your cognitive function starts with awareness. If you rely on PPIs or similar medications, consult your doctor to evaluate your treatment plan. Explore alternative approaches, such as dietary changes, lifestyle modifications, or shorter treatment cycles when possible. Medications play a vital role in managing health, but using them responsibly can prevent unintended consequences. By understanding the potential impact on memory and cognitive function, you empower yourself to make informed choices that prioritize both immediate relief and long-term well-being. Knowledge is your first line of defense. Stay informed, stay proactive, and prioritize your mental clarity. 2. Anticholinergics, the unseen dangers lurking in common medications. Anticholinergics are among the most frequently prescribed drugs today, used to treat a variety of conditions such as Parkinson's disease, overactive bladder, and chronic respiratory issues. These medications work by blocking acetylcholine, a neurotransmitter that plays a vital role in numerous bodily functions, including memory, attention, and learning. Despite their widespread use and effectiveness in managing certain conditions, anticholinergics carry hidden dangers, particularly for the brain. Research reveals that prolonged use of these drugs is linked to an increased risk of developing cognitive disorders, including dementia. A landmark study by the University of Washington, which followed more than 3,500 elderly individuals over the course of a decade, highlighted a staggering finding. Those who regularly used anticholinergics had a 54% higher risk of developing dementia compared to non-users. This risk grew with the length of use and the dose taken. The connection between anticholinergics and cognitive decline is not without evidence. Medications like scopolamine, meclizine, atropine, benztropine, oxybutynin, trihexyphenidyl, and dimenhydrinate are among the most commonly linked to memory impairment and cognitive dysfunction. These drugs interfere with brain function by blocking acetylcholine, disrupting the communication between neurons, and ultimately impairing memory and learning. However, not all anticholinergic drugs pose the same level of risk. Certain medications, such as glycopyrrolate, trospium, tolterodine, darafenacin, fesoterodine, tiotropium, and umeclidinium, especially when administered via inhalation, have shown no significant association with cognitive decline. This offers hope that alternative treatments might be available for those who need them. The widespread and often unchecked use of anticholinergics, particularly in older adults, raises significant concerns. It is critical that both patients and healthcare providers approach these medications with caution. Careful consideration of the potential risks and benefits is paramount. Where possible, doctors should explore alternative therapies and minimize the duration and dosage of anticholinergic use. In addition to cognitive risks, anticholinergics can cause a range of uncomfortable side effects. These include dry mouth, constipation, urinary retention, blurred vision, and difficulty in focusing. For older individuals, these side effects can severely impact daily living and overall quality of life. Awareness of these risks is essential. It is only by understanding the full scope of potential side effects that we can make informed decisions about our health. Being proactive in seeking safer alternatives and minimizing unnecessary medication use will not only protect our cognitive health, but also enhance our overall well-being. 3. Corticosteroids, unveiling the brain's hidden risks. Corticosteroids are potent and versatile medications widely used to manage conditions like asthma, allergies, autoimmune disorders, and chronic inflammation. Despite their effectiveness, prolonged use, especially in oral form, has been linked to significant mental and cognitive side effects, underscoring the importance of informed and cautious application. Research highlights the impact of corticosteroids on brain health. A UK-based epidemiological study involving over 500,000 individuals revealed that long-term corticosteroid users had an elevated risk of developing dementia, depression, and anxiety. Glucocorticoids, such as prednisone and dexamethasone, are particularly notable for their long-term effects, likely due to their influence on cortisol, a stress hormone that can harm neurons in the hippocampus, the brain's memory hub. Even inhaled corticosteroids, including fluticasone, budesonide, and mometasone, often perceived as safer options, may lead to adverse outcomes when used in high doses or over extended periods. These findings challenge the assumption that their localized delivery spares broader systemic effects. Beyond cognitive concerns, corticosteroids carry a host of other risks. Long-term usage is associated with conditions such as osteoporosis, diabetes, hypertension, and increased vulnerability to infections. These side effects demand vigilant medical oversight. Patients and caregivers alike should emphasize minimizing dosages and treatment duration to achieve therapeutic goals while reducing harm. Alternative therapies and non-pharmacological strategies play a pivotal role in reducing reliance on corticosteroids. Physical therapy, lifestyle modifications, and targeted biologics offer promising pathways for certain conditions. By integrating such options into care plans, healthcare providers can mitigate risks and promote holistic well-being. The connection between corticosteroids and mental health underscores a critical need for awareness. By fostering a deeper understanding of their effects, we can ensure safer, more responsible use of these indispensable but double-edged medications. safeguarding both immediate and long-term health outcomes. 4. Benzodiazepines, a silent danger to memory. Benzodiazepines, a class of medications commonly prescribed for anxiety and insomnia, offer rapid relief by calming the mind and body. Drugs like alprazolam, diazepam, and lorazepam are often seen as life-saving solutions for those struggling with mental health conditions. However, beneath their soothing effects lies a hidden threat to cognitive function, particularly memory. Research has uncovered a troubling link between long-term benzodiazepine use and significant memory impairment. Studies show that the longer individuals take these medications, the higher the risk of developing Alzheimer's disease. In fact, prolonged use may double the likelihood of cognitive decline, possibly due to irreversible damage to brain cells. One study revealed that over 40% of users experienced neurological symptoms, including difficulty focusing, fatigue, nervousness, and heightened sensitivity to sensory input. But the risks don't stop at memory loss. Chronic use of benzodiazepines can bring a host of other complications. Patients often report difficulty sleeping, persistent anxiety, muscle weakness, and body aches. Additionally, these medications can lead to both physical and emotional dependence, making it incredibly challenging for individuals to stop taking them. The connection between benzodiazepines and Alzheimer's disease is particularly alarming. While the exact mechanisms remain unclear, it's believed that these medications interfere with neurotransmitter activity, disrupting the brain's delicate balance. This disruption can lead to lasting structural and functional changes in the brain, which in turn affect memory and cognition. Furthermore, benzodiazepines can significantly alter the sleep cycle, which is crucial for memory consolidation and overall brain health. Given the severity of these risks, it is vital that the use of benzodiazepines is carefully monitored. Physicians should explore alternative treatment options for anxiety and insomnia, such as cognitive behavioral therapy, relaxation techniques, and lifestyle modifications. When benzodiazepines are necessary, they should be prescribed only for the shortest duration possible and at the lowest effective dose. Raising awareness about the dangers of long-term benzodiazepine use is crucial for protecting brain health. By prioritizing safer, more sustainable treatments, we can help individuals manage anxiety and insomnia without jeopardizing their cognitive function. In the end, understanding the hidden risks of these medications is the key to preserving memory and promoting overall well-being. 5. The hidden dangers of amphetamines. Memory and beyond, amphetamines, including the well-known Adderall, are frequently prescribed to treat attention deficit hyperactivity disorder, ADHD. These drugs are renowned for their immediate effects on focus and concentration, offering temporary relief to those struggling with ADHD symptoms. However, the longer they are used, the more the risks become evident, particularly when it comes to memory and cognitive function. When we take amphetamines, they boost the levels of neurotransmitters like dopamine and norepinephrine in the brain. This surge creates a heightened sense of alertness and improved mental clarity. In the short term, this can feel like a breakthrough, allowing users to maintain focus and manage tasks more easily. Yet, as the brain adapts to this stimulation, the balance begins to shift. Prolonged use of these drugs can have devastating consequences. While they may enhance concentration in the short run, their long-term effects are far from harmless. Memory loss is one of the most troubling outcomes. Studies reveal that persistent, high-dose use of amphetamines can cause lasting brain damage. Even after discontinuation, users often experience persistent cognitive impairments, with memory being the most noticeably affected area. But memory problems are just the tip of the iceberg. Long-term amphetamine use can lead to a range of other issues. Motivation can sharply decline, making everyday tasks feel overwhelming. Cognitive performance as a whole deteriorates, affecting everything from decision-making to problem-solving. These changes can erode a person's overall quality of life, with effects that linger well beyond the drug's use. Equally concerning is the potential for abuse and addiction. Due to their stimulating properties, amphetamines are frequently misused. often in an attempt to enhance performance or stay awake. This misuse can result in life-threatening conditions such as heart arrhythmias, severe gastrointestinal issues, and in extreme cases, even sudden death. The psychological dependence that develops can be just as dangerous, making it difficult to break free from the cycle of use, even in the face of negative consequences. Given these dangers, it is essential that amphetamines be prescribed with care and monitored closely. Healthcare providers must ensure that patients fully understand the risks involved and stick to recommended dosages. Moreover, patients should be encouraged to explore alternative treatments for ADHD, including behavioral therapy, mindfulness, and stress management techniques. These approaches can provide lasting benefits without the serious risks associated with medication. 6. First-generation antihistamines, quick relief, hidden risks. First-generation antihistamines, like chlorpheniramine and diphenhydramine, are common remedies for allergy and cold symptoms. They swiftly ease congestion, itching, and sneezing, bringing immediate comfort. However, these medications carry hidden dangers that can affect cognitive health in the long run. These antihistamines block histamine, the chemical responsible for triggering allergy symptoms. While this action provides quick relief, they also interfere with acetylcholine, a vital neurotransmitter for memory, learning, and overall brain function. This interference can impair memory and cognitive abilities, especially with extended use. Research has linked long-term use of first-generation antihistamines to an elevated risk of dementia. A review of 138 studies revealed a strong connection between prolonged use and cognitive decline. Even after discontinuing the medication, many patients reported persistent memory issues and difficulty focusing. Thankfully, safer alternatives are available. Second-generation antihistamines, such as loratadine and cetirizine, offer effective symptom relief without the same cognitive risks. These medications are preferable for managing allergies over the long term, allowing patients to avoid the harmful side effects of older drugs. Aside from memory problems, first-generation antihistamines can cause drowsiness, dry mouth, and blurred vision. These side effects can reduce overall quality of life, particularly in older adults who may be more vulnerable to them. To safeguard cognitive health, it is crucial for patients to consult their doctors before using first-generation antihistamines on a long-term basis. Exploring safer alternatives and integrating other allergy management strategies, like environmental adjustments and dietary changes, can reduce reliance on these medications and protect brain function. 7. Tricyclic antidepressants, unveiling the link to memory loss. Tricyclic antidepressants, TCAs, including amitriptyline and nortriptyline, were pioneering drugs in the fight against depression, introduced in the mid-20th century. Though they effectively alleviate depressive symptoms, their long-term use is closely tied to cognitive side effects, particularly memory loss. These medications are known for their complex interaction with the brain's neurotransmitters, but they also present a hidden danger: cognitive impairment. TCAs work by inhibiting the reuptake of neurotransmitters such as serotonin and norepinephrine, thereby boosting their presence in the brain. However, these medications also exhibit potent anticholinergic effects. By blocking acetylcholine, a neurotransmitter crucial for memory and learning, TCAs can impair cognitive functions, especially in areas like concentration and recall. Studies have demonstrated that prolonged use of TCAs is linked to a higher risk of developing dementia and other cognitive disorders. Research from the Journal of Clinical Psychiatry, 2018, reveals that patients on long-term TCA therapy experience a 30 to 50% faster decline in cognitive performance compared to those not using these drugs. Symptoms such as confusion, difficulty concentrating, and both short and long-term memory problems are commonly reported. In fact, a study published in The Lancet Psychiatry, 2020, found that the risk of cognitive decline is more pronounced in older adults who are more sensitive to the anticholinergic effects of these medications. The elderly are particularly vulnerable as their brain's response to acetylcholine diminishes with age. This population often experiences more severe memory impairments, raising concerns about the widespread use of TCAs in older individuals. As the understanding of TCA's cognitive risks has expanded, safer alternatives have emerged. Selective serotonin reuptake inhibitors, SSRIs, like fluoxetine and sertraline, are now the preferred first-line treatments for depression and anxiety. These medications carry fewer cognitive side effects and offer a more favorable safety profile. According to a 2023 study published in JAMA Psychiatry, SSRIs have a 40% lower risk of memory-related side effects compared to TCAs, making them a safer option for long-term treatment. Beyond memory issues, TCAs also cause a range of unpleasant side effects, including dry mouth, constipation, blurred vision, and weight gain. These effects can significantly impair quality of life, leading to treatment discontinuation in some cases. To ensure optimal treatment outcomes, it's crucial that healthcare providers and patients engage in thorough discussions about medication options. While TCAs can be effective in treating depression, their cognitive side effects must not be overlooked. Regular monitoring is essential, particularly for older adults, and safer alternatives should always be considered to minimize risks. 8. Statins, the paradox of cholesterol and cognitive health. Statins like atorvastatin and simvastatin are frequently prescribed to lower cholesterol and prevent heart disease. These drugs are essential in reducing the risk of heart attacks and strokes, saving lives worldwide. Yet, emerging evidence raises concerns about their impact on brain health, especially with long-term use. While statins are generally well tolerated, some individuals report troubling side effects, particularly cognitive issues. Memory problems and confusion, although rare, can significantly affect a person's quality of life. Researchers believe that statins may disrupt cholesterol production in the brain, which is critical for memory, learning, and overall brain function. The connection between statins and cognitive decline is complex. Some studies suggest that statins could actually protect against dementia, offering a potential defense against Alzheimer's. However, other research points to an increased risk of memory problems with long-term use. These conflicting results likely stem from variations in dosage, treatment duration, and patient demographics, underscoring the need for more focused studies. Beyond cognitive concerns, statins are known to cause side effects like muscle pain, fatigue, and digestive issues. For some, these symptoms are severe enough to discontinue treatment, diminishing the overall effectiveness of the medication. To address these risks, open communication between patients and healthcare providers is crucial. Monitoring for cognitive changes and adjusting treatment plans accordingly can help minimize negative outcomes. Additionally, encouraging patients to embrace a heart-healthy lifestyle, balanced nutrition, and regular exercise can help control cholesterol naturally, reducing dependency on medication. Being aware of the potential cognitive effects of statins empowers patients to make more informed decisions. Ultimately, a balanced approach to managing heart health can safeguard both the body and mind. Self-medication and long-term use of certain medications can severely impact memory and cognitive function. This video highlights the risks associated with common drugs like anticholinergics, corticosteroids, benzodiazepines, amphetamines, first-generation antihistamines, tricyclic antidepressants, and statins. Over time, these medications can have a detrimental effect on the brain. It's crucial to always consult your doctor before starting or continuing any medication. Engaging in informed discussions about potential risks, benefits, and safer alternatives is essential for maintaining both brain health and overall wellness. Thank you for tuning in. Be sure to subscribe, leave a comment, and share your thoughts or experiences below. Don't forget to share this vital information with your loved ones. Wishing you continued health, prosperity, and joy. See you in the next video.